I've been referred to my ophthalmologist for cataract surgery. What happens next?
When a patient is referred for cataract surgery, they will typically meet their ophthalmologist before surgery for a consult. And at that consultation, the ophthalmologist will evaluate the cataract, but also the health of the remainder of the eye, looking for any comorbid conditions. And after that initial consultation, you will typically have a pre-op appointment, which will involve some measurements of the eye so that we can best select the right intraocular lens for your surgery.
What types of IOLs are there, and what are the benefits of each?
So there are a number of classifications for intraocular lenses. The simplest is just a non-toric monofocal lens that's designed to give good distance vision in a patient that does not have astigmatism. The next level of lens would be a toric lens. A toric lens is a lens that corrects astigmatism and your distance vision. Sometimes people will use them to give you reading vision only instead of distance, but most of the time will adjust you to give you good distance vision without glasses. Then there's two really interesting sorts of lenses. The more common and more modern one is called an extended depth of focus lens. And that's a lens that typically should correct up your astigmatism, give you good distance vision, but also very good intermediate vision and some near vision. It's a lens that's very well tolerated, generally gives people very good outcomes, and it's a lens you can use in many people that may not be an ideal candidate for so-called presbyopia correcting intraocular lenses. The most advanced lens in terms of reading vision correction are trifocal lenses. Trifocal lenses again come in toric options, and those are lenses that again will correct your distance vision and your astigmatism. They should give you very, very good intermediate vision and very good near vision. The downside is they can have a little bit more halo, a little bit more glare, a little loss of contrast. But again, in the right patient, in the right eye, they give excellent, very surfacial vision, generally in all areas of vision. Typically, patients with multifocals or trifocal lenses don't wear glasses after surgery or very seldom wear glasses. There are exceptions, and again, that discussion needs to be held with the ophthalmologist caring for you.
How do my day-to-day activities impact my lens choice?
Yeah, when it comes to lens selection, I always tell patients it's a bit like when you go to the optometrist. There's a variety of different lenses that are beneficial for doing different things. And I think the most important question to ask yourself is to say, what sort of things do I like to do? So I've had some patients come into me and they say, I'm a sharpshooter. I like to go hunting and I need to see way over there and it needs to be clear. I also had a gentleman who's a tugboat captain, and same thing. He was like, I want to see really clearly far away. Whereas some other patients come to me and they have hobbies that are sort of under their nose or very close. And so those sorts of, finding out those bits of information is very useful for your surgeon to help make a recommendation about lenses. Other people come and they say, well, I'm kind of an all-arounder. Like I like to be pretty active and there's lots of things I like to do, and I do like to read a bit, and I want to make sure that I don't need glasses to drive. So when we hear these sorts of things, it helps us make a lens selection for patients. So perhaps somebody who really liked to do a task like crocheting, we would select a lens that would see very clearly for near, and they might require a spectacle for distance. Alternatively, if somebody wanted to see very clearly far away and that was their main goal, they might benefit from a reading glass after the surgery but do well with a single focused distance lens. And for patients who like to do a number of different things or would like a little bit of all those, we can recommend a lens that has extended depth or even multiple depths.
Can I choose two different lenses?
I get asked often if a patient can choose two different lenses, and the way I would answer that question is by saying you can only have one lens in each eye. And typically you'd have the same lens implanted in both eyes when the time comes for cataract surgery in the second eye.
Will I need glasses or contact lenses after surgery?
I always remind patients that the primary purpose of cataract surgery is to remove the cataract and restore vision. Having said that, we're so fortunate to have so many different intraocular lenses available to us that can correct our refractive error at the time of cataract surgery. Depending on which lens the patient selects, they may need distance glasses, they may need reading glasses, they may need bifocals, but it really depends on which lens is used. With a monofocal lens, for example, which is typically targeted for distance, a patient should expect to wear reading glasses for all near tasks. With an extended depth of focus lens, a patient will have reduced need for spectacles, but will still use them for near tasks. And with a trifocal lens, a patient will have spectacle independence for most tasks for most of the day. So in the end, it really does depend on which lens the patient selects and which lens is appropriate for them.
Will my other eye conditions influence the lens selection?
In terms of other eye conditions, it's certainly important to discuss those with your ophthalmologist at the time of surgery, because these can impact the intraocular lens selection for the patient at the time of cataract surgery. So for example, patients with myopia or hyperopia or astigmatism, this is simple refractive error, and these things can be easily addressed at the time of cataract surgery. But there's other conditions like macular degeneration, glaucoma, diabetic retinopathy, dry eye, that can really impact the outcome following cataract surgery, and these things are not necessarily addressed at the time of cataract surgery, and so they can have an impact on which lens is appropriate for the patient.
I have astigmatism. Does that limit my lens choices?
Astigmatism means that the shape of your eye demands a different power of the lens in one direction versus the other direction. We all have some degree of astigmatism in our eyes. Whether or not your astigmatism is going to affect your vision after the surgery will be determined by special measurements that are taken before the surgery. If you do have significant astigmatism after the surgery, you may still require glasses unless you choose a toric lens. Toric means that there is special astigmatism power built into the lens that is then aligned with the direction of the astigmatism in your eye at the time of surgery. The goal of a toric lens would be to eliminate your need for glasses after surgery.
How do I know I'm choosing the right lens?
So many people come in and they say, Doc, I just want the best lens. I want the lens that's going to give me everything. And sometimes this is a good opportunity to sort of set expectations and say, there's not a lens in the world that's going to give you, the 18-year-old vision, that you once had. However, it's about finding the sort of things that you like to do and giving you, good vision for what you're doing now. I tell people that having a lens is a little bit like a blanket, and the blanket can cover your toes and your shoulders might stick out a bit, or we can pull the blanket a little bit closer and your shoulders will be covered, but your toes might stick out. And that kind of lets them understand the range of vision we have, and we can attempt to move that range of vision a little bit closer, perhaps sacrificing a bit of the distance, or we can try to move it out and give them good distance vision, understanding we might need to sacrifice a little bit of near vision. And most people seem to understand that, and that helps them make a decision.
Who pays for cataract surgery? Is it covered by my provincial or private insurance?
We are very lucky in Canada that our provincial and territory health plans cover cataract surgery. So a patient does not have to pay out of pocket for cataract surgery. Having said that, there are specialty lenses available that may not be covered by the provincial health plan, and a patient may have to pay for those, or they may be covered by their secondary insurance through work, for example.